When you sprain your ankles more than 2 times, you have an inherent weakness in the muscles along the ankle, below the knee, mostly on the side, these muscles on the outside. How you doing, everyone? If you're someone that suffered or has suffered from multiple ankle sprains, you're going to want to watch this, okay? Hate to use you here as a guinea pig, but we have a soccer player here who, I guess you first sprained your ankle in soccer. Was that the first time?
Yeah.
Of many? So one thing I want to go over is when you sprain your ankles more than 2 times, you have an inherent weakness in the muscles along the ankle, below the knee, mostly on the side, these muscles on the outside. Because typically when people roll their ankle, they roll it in. Rolling it out, that was like a Dak Prescott injury. You don't want that. You're going to break your ankle, which he did. But when you roll it in and you have you do that twice, then you have an inherent weakness in there, and you're going to keep rolling your ankles. And not only that, you're going to have knee problems, hip and back problems, and voila. We have him here who has knee problems, severe knee pain, and hip problems. And the other thing is I want to discuss is he came from Houston, right? You moved here from Houston?
Yeah.
So he drove everywhere. He drove to the store, to home, and walked 20 feet to his garage, you know, or to his house. And so he moved to New York, and now he's on his feet a lot more, playing soccer and just on his feet more. We walk so much more here in New York, and because of that, he now has developed knee pain and has some back pain. So number one, we have to get him orthotics. So we'll scan his feet. Our scanner's down, our Wi-Fi's down today, but we'll scan his feet and do a 3D imaging of his feet, get him some orthotics, and that's the long-term fix. But I want to show you how we adjust his ankle. And last time he was in here, we adjusted his ankle, his calcaneus, and you felt better, you said, right?
Yeah.
And then did you have any knee or ankle pain since then, since I did that?
No, it felt
Okay.
fine.
Okay, so it's out again. I'll show you how we tested. It's an easy test, but it is out of place again here on the left side. So we're going to correct that. We're going to adjust that. And then hopefully it holds. If I see him next week, it's Saturday. So if I see him next week and it's out again, and I have to adjust more than 3-4 times in a 2-week period, then that's a concern for me that all the ligaments and tendons are stretched out here in the ankle, and that's a bad sign, and I already think that's what's going on here. So we may have to tape him. We'll also have to do some cold laser therapy and some physical therapy. And you see I have some wobble boards here and a Bosu ball here, and that can help him rehab, and he has to do that, otherwise he will continue to develop knee pain and ankle problems, sprain his ankles, even with the orthotics under his feet. So we're going to start off with some cold laser therapy for him today. And the cold laser does a lot. First, we're going to just focus on pain and inflammation and muscle spasms, but it heals and repairs soft tissue damage. And again, what did I say after 2 ankle sprains? It damages the soft tissue. There's an inherent weakness in those muscles. So we want to fix that with physical therapy, therapeutic exercises, and cold laser therapy. So we're going to go ahead and quickly laser you here on the outside of the ankle. You won't feel anything, okay? So one of the best exercises you can do, you know, if you've sprained your ankles, you know, if you just sprained your ankle and it's acute, you don't want to get it adjusted. That's number one. But laser therapy is definitely great for you to do if it's an acute ankle sprain. It just happened within the last 4 to 6 weeks. And after that, when the laser is kicking in and effective, that's when you can go ahead and start the exercises like a wobble board or a Bosu ball to strengthen up all the muscles here on the sides and around the ankles. Now, a lot of basketball players have this problem. A lot of sprained ankles with basketball players. I also see this a lot with triathletes that do trail running. I'm a triathlete myself, but triathletes that do trail running, and ironically, I did one triathlon, and it was a trail run, and I didn't know it. And then when I got to the race, it was a little rainy the night before, and I ran the race, and of course, the last 2-3 miles, I twisted my ankle. And that was the first time I've ever twisted my ankle. Thank God I haven't done it since, but so trail running is, people are susceptible to that. Soccer is another sport. Tennis, a lot of that side-to-side motion. And as a teenager, I played tennis. So I was lucky because I think I really built up these muscles along the sides of my knee and ankle here. Pronator muscles and all my calf muscles. And I had a good opportunity to really build that side-to-side motion up playing tennis, going back and forth at the baseline. So I think that helped me strengthen the area, because I've stepped on a uneven curb or sidewalk and rolled my ankle and caught it before I ever sprained it. So that's where you want to get to, where you can step on an uneven surface and it rolls your ankle, and your muscles are able to kick in, your quick twitch fibers, are able to kick in and resist and prevent you from rolling it all the way and injuring and possibly injuring ligaments or tendons. And I'm able to do that because I have that strength, and that's where I want to get you, okay? And that's where we're going to get you, all right? So you can keep playing soccer without these problems. Were you feeling it this high up?
No, it's usually a little lower.
Okay. Another tidbit I want to discuss, which I didn't mention, is ankle sprains, right? So you got a couple different types. You got a low ankle sprain and a high ankle sprain. High ankle sprains are worse. They take longer to heal. Oftentimes you see high ankle sprains when athletes tape up their ankles, and then they twist their ankle and they've got nowhere else to go. But so when you tape up an ankle, you risk a high ankle sprain. So be careful with that if you're taping your ankles for football or soccer or some other sport. That's something to be aware of. Low ankle sprains typically heal a lot faster. And how do you tell if you have a low ankle sprain? Well, if you sprain your ankle and you have pain here, it's probably a low ankle sprain. If you have pain or swelling or bruising up here, it's worse, and it's a high ankle sprain most likely, okay? Obviously there's MRIs and imaging that you can do as well. So we're gonna go ahead and adjust Brian's ankle here. Okay, we're gonna do an ankle calcaneus adjustment here on the left side. Just relax yourself. I'm internally rotating your hip here for a reason. We don't wanna hurt your hip here, and just relax yourself here, okay? Good. And there we go. You can see now, it's hard for you guys to see from that angle, but now his ankle dorsiflexes evenly. All right, we're going to check you again next week and see if that ankle adjustment holds. Do you have any questions about what we just did?
No.
Okay. Come on up here. Let's check you out on the wobble board. I want you to try them out. They're different. This is a Bosu ball. Go ahead and gently stand up there, 1 foot on the edge. So put your foot out here. Yep. I would probably use sneakers. You'll get a better grip. Yep. Okay, and you just want to, you can rock back and forth, left to right. Want to try to keep your hips straight. Yep. And keep your knees bent and just keep the movement all in your ankles. Right? So you're trying to do that. And then you can do counterclockwise, clockwise. This is a little bit more advanced. So if you're beginning and just starting out, you'll come off of that one. But you can see that what I'm talking about here. We're going to try the wobble board. That's more for beginners. Yep. Okay. Folks, these you can get these for cheap. They come square or round with a little ball on the end, on the bottom. And again, this is a little bit more for beginners. And you're going to go side to side. It's not easy by any means. You want to put your feet out wide. There you go. And you can go side to side.
No.
You could do a, yeah. clockwise, counterclockwise. But what that's going to do is build up all these muscles in here. It's one of the best things you can do. The second best thing you can do to strengthen those muscles around the ankle is a vibra plate. And you stand on one leg, and all that vibration helps to trigger all those smaller muscle fibers in the ankle and around the ankle. Okay?
Okay.
All right, you're all set. I'll see you next week.
All right. Thank you.
All right. Thanks for tuning in, everyone.